Next month, more women in Michigan will start learning about breast density and how it can make your mammogram less effective at finding cancer. All week long, we've been dissecting a new state law that will require that you be told in your results letter if your mammogram found a certain amount of dense breast tissue. But Target 8 found not all insurance carriers are ready to pay for supplemental tests beyond mammograms. Dr. Jennifer Rollenhagen is a radiologist at Mercy Health. She joins us in studio today. We appreciate your time.
Thanks for having me.
We've been talking about this all week long. Is there a concern that women will want the more advanced screening options, but will they be able to pay for them if the insurance doesn't?
So that is a concern. Whenever a woman has a screening test, we want to make sure that the risk of the test is far lower than the benefit. So one of those risks is cost. Costs of supplemental screening or advanced screening such as MRI and ultrasound are much higher than mammogram. And so we have to take into account a cost and really what the true risk behind having dense breast is. Really, a woman with dense breast has a slightly elevated risk of getting breast cancer over the background population, over her background baseline risk. And so those advanced screening, is the cost worth detecting a few more cancers? And that's the question that needs to be answered.
Yeah, it's tough for the patient because it is so difficult to see any tumors that might be on that dense breast tissue because of the white on white picture
Certainly.
that the mammogram gives.
And just so that women know, mammograms in dense breast can still be very effective. Certain things like calcifications that show up as their sign of breast cancer can be seen with women in dense breasts. Areas of architectural distortion can still be seen with women in dense breasts. Mammograms have been shown to save lives across all breast densities.
That's certainly the first line of defense. Get your mammogram and see where you stand with that dense breast tissue. So we've asked this question to several doctors all week long. The answers have varied slightly. We touched on it a little bit. If a woman gets a results letter and it says that you have dense breast, that might make it harder to find cancer. What do you think is the additional testing that you would recommend at that time?
First, I want to step back and have the woman have an honest discussion with her healthcare provider as to what her true risk is. They should talk about family history. They should talk about gene mutations that increase their risk for developing breast cancer. They should talk about diet, exercise, alcohol intakes, things like that that we can do to reduce our risks. And then the healthcare provider should identify those women at a significantly elevated risk, about 20 to 25% lifetime risk. And at that point, those women really should have supplemental screening such as breast MRI or ultrasound.
Ultrasound or breast MRI is what you're suggesting. So what do you want women not to do with this information?
Certainly, stop getting mammograms. I don't want a woman to say, well, a mammogram doesn't work for me because I have dense breast. I want women to continue getting mammograms annually starting at age 40. If you're identified as having an elevated risk, get them earlier. And talk to your healthcare provider about what type of, or what time to screen. We also have 3D mammography that has been around for a couple years now that's really, really promising.
Okay, good suggestions. Thank you so much for joining us. Dr. Jennifer Rollenhagen, thank you. If you want to learn more about this issue and it impacts and how many women it impacts, nearly half, you can find lots of clear, concise explanations, resources, and personal stories at woodtv.com. Just scroll down on the right side of the homepage and look for the pink Are You Dense section.